Morning everyone, welcome to Pediatrics by Dr. Anand. Such a beautiful day today. Good morning in regards to all. My name is Dr. Anand. Today we all have gathered for the discussion of the Neet Pg 2024 recall questions. Quickly, please let me know, is my voice coming to everyone? Yes or no? Please let me know in the comment section. Thank you very much. Today we're going to talk about the Neet Pg recall questions. Some new, some old questions. Some questions were new here and there, but a little bit were new and some were old. Is my voice coming to everyone? Please let me know in the comment. Thank you so much. Yes, everything is working well. Good morning, Swati. Good morning, Kamal Sharma. Let's start off this beautiful class. My name is Dr. Anand, and quickly we're gonna start off. Just a quick thumbs up from everyone, that is my voice coming to everyone or not. Good morning, everyone. Hello. Yes. Okay. Yes, little zoomed up. Okay, no problem. Yes, we're gonna start off this class. My name is Dr. Anand. Yes, 1 second. Okay, perfect. Yes, is my voice coming to everyone? Please let me know in the comment section. Thank you so much. Yes, good morning everyone. Yes, 1 second. Let me check. I think everything is positive. Everything is okay. Quickly, last time. Yeah, I think now it's coming. Yeah, good morning everyone. Let's start off. My name is Dr. Anand and today we have gathered for the Neet PG questions. And before starting any segment, we always have a quote, and quote for today is that if there is no way, create the way. Very beautiful quote which says, if there is no way, create the way. Life is just one. Life is beautiful. Good morning, Naza. Good morning, Swati. Good morning, Kamal. Good morning to the people who have got up this morning. Today we have witnessed, and let's share some bloody crazy 100% awesome knowledge. So if there is no way, create one. Life is just one. See, this picture is so meaningful. Sometimes we are lost, sometimes we don't have a path, sometimes we say that I want to do something different, I want to do something nice. So like this 5:30 a.m. series, I want to do something different, and yes, different is the new different. So today's topic of choice, yes, let's start off with the MCQs. Very nice, simple questions are there for the Neet PG 2024 recall. A 3-month-old baby with intracranial diffuse calcifications, chorioretinitis and hydrocephalus, what is your diagnosis? Very beautiful point. We must appreciate that the baby with, so we have done this part multiple times. What is the triad of congenital toxoplasmosis? The triad of congenital toxoplasmosis is, I told you, 3 calcifications are very important. One is intracranial diffuse calcification. So this white intracranial diffuse calcification, you should think of what you called congenital toxoplasmosis. If the patient has this white dots over the ventricle or near the ventricle, known as periventricular calcifications. So where do you see periventricular calcifications? The answer is cytomegalovirus. Where do you see intracranial diffuse calcification? The answer is congenital toxoplasmosis. So 3 calcification must appreciate, that is intracranial diffuse calcification, that is toxoplasmosis. Periventricular calcification you see in cytomegalovirus. I remember in 2023 Neet PG they had asked on rubella also. So 3 calcifications done: diffuse calcification, periventricular calcifications. And where do you see gray matter white matter calcification? Where do you see gray matter white matter calcifications? In my recent class also I told you, Zika virus have gray matter white matter calcification. So Zika virus over, cytomegalovirus over, and Neet PG question was congenital toxoplasmosis. Yes, Shiv. Yes, a haircut. My father expired actually a few days back, that's why this haircut is there. Okay, let's start off this class. Next, yes, this is a very nice question. This question was direct question from our notes, and the question was like this. This is the graph, and what is LSBP. Okay. So one thing we have to understand over here. Morning Kamal, morning Swati. Something happens at 2 years, something happens at 6 years, and something happens at 12 years. So whatever you're reading right now, tell yourself you're reading this for the first and last time. Okay, first and last time. ये अब सारी उम्र याद रहना चाहिए. If I ask you very importantly, when is the maximum time of your puberty, or maximum growth spurt of the puberty? So yes, the puberty happens by 12 years. The maximum peak of the puberty and the somatic growth. Please remember PS, the mnemonic is PS, P and S. P and S. Remember pulmonary stenosis, P and S. So P for puberty and S for my somatic growth. Both the peak happens at 12 years. Number 1. And we have done the brain development. The maximum brain development happens by 2 years. The maximum brain development happens by 2 years. The maximum growth of puberty and somatic growth will happen by 12 years. And the maximum lymphoid growth, that will happen by 6 years. So 2 into 6 is 12. 2 into 6 is 12 to 2 years brain growth, 6 years lymphoid growth, and 12 years puberty and somatic growth. Will you remember this? Yes. Okay, no problem, Shiv. Next one. Yes, the next important point, yeah, this was the question in the part A of the shift of the exam. At what pressure pop-up valve is released in bag and mass ventilation? Now this is a new question. In our main videos we have done this question actually, but in the regular talk we don't talk such question because it's a DNB question actually. It came in DNB paper, but now it's coming in Neet Pg also. I think it's very good. Well, very good as in very sad. So at what pressure the pop-up valve is released in bag and mass ventilation? So please remember, yeah, so yeah, as in, yeah, so at 30 to 40 centimeter of water, 30 to 40 centimeter of water, I'll tell you NASA. So 30 to 40 centimeter of water is the pressure at which pop-up valve is released. You know, now bag and mass ventilation, bag and mass push, you do that. Once you do the bag and mass ventilation, there is a valve above known as pop-up valve, So that pop-up valve is releases its pressure by 30 to 40 centimeter of water. This is a new question, please remember that. Okay, next one important, yeah, a 1-month-old baby with olive shaped mass and recurrent vomiting. Olive shape, where do you see olive shaped mass in a 1-month-old child? In congenital hypertrophic pyloric stenosis. Ultrasound was done, which is shown below. Now this was the question. In the exam, they had already told in the recall that this case is a case of congenital hypertrophic pyloric stenosis. Now, ultrasound what is the significant? So, we all know that very importantly, you know, that 4 and 14, 4 and now I'm saying 4 mm and 16 mm. So, 4 mm in the thickness and 16 mm in the length of this pylorus or pyloric stenosis. So, that's what is shown in the picture in ultrasound, and that's why the best answer for this question is congenital hypertrophic pyloric stenosis. The pyloric thickness is 4 mm in thickness and 16 mm in length. Remember that. Okay, very good. Next question. Yeah, one student said that one more question of CHPS come again. It was a straightaway question. The question was 1-month-old baby with complaints of projectile vomiting with olive shaped mass. An X-ray abdomen showing this. So what is the X-ray abdomen showing? So we all know that X-ray abdomen showing is nothing but, I'll just get a side. I think you can see, visualize also. You can see a single bubble sign. Very good. So where do you see single bubble sign? So single bubble sign you see in, very importantly, congenital hypertrophic pyloric stenosis. So we have single bubble, double bubble, triple bubble. This is single bubble. Then the next one, this one will be the double bubble, and this one will be the triple bubble. Once again, this is the triple bubble, this is the double bubble, and this is the single bubble. So single bubble sign you see in pyloric stenosis, and after pylorus you have duodenum. So double bubble sign you see in duodenal atresia. After duodenum you have jejunum. So jejunal atresia you will see a triple bubble sign. Next question we have is, a child present with intellectual disability, hepatosplenomegaly, the bone marrow showed crumpled paper appearance. Crumpled paper, this one word itself is enough. The crumpled paper appearance is seen in Gaucher disease, and Gaucher disease is because of deficiency of the enzyme glucocerebrosidase. So deficiency of the enzyme glucocerebrosidase is what you see in a case of Gaucher disease. A crumpled paper appearance, remember that. Okay, very good. Next question. Yeah, there were two questions on cystic fibrosis. एक तो ये था, which of the following is true about cystic fibrosis, as in not celiac disease. Which of the following is true about the celiac disease? Celiac, you know that celiac, right? Whatever I feed my baby, he go to washroom. Whatever my child eats, he go to washroom, right? So diarrhea, chronic diarrhea the patient will have in celiac disease. Most importantly, if I have to rule out celiac disease, what investigation I will like to do? I will do a TTG. Tissue transglutaminase is what we'll do. Tissue transglutaminase, that will be an investigation which I'll be doing to rule out cystic fibrosis. This was one question. In the other shift, same question on the celiac disease was, a baby is having failure to thrive with skin lesions which improved on gluten-free diet. Something which has improved on gluten-free diet. I think we are talking about celiac disease. We are talking about celiac disease. So I'll cut over here cystic fibrosis and I'll write over here the best answer becomes to us. That's what is celiac disease. So options is not important. Like what I'm trying to say is that if I have to make an option, then I'll make the option number A celiac disease, option number B TTG positive, option C SAM, and option number D will be A plus B both are positive, and then the option becomes A plus B both are positive, because celiac disease only you get your TTG done. So did you understand which of the following is true about celiac disease? The anti-tissue transglutaminase should be positive, and the patient will have whatever I eat I go to washroom, whatever I eat I go to washroom, means the patient will be a case of failure to thrive, means not gaining weight and height. And skin lesions, what are the skin lesions are you expecting in a case of what you called celiac disease? Skin lesion important, that is dermatitis herpetiformis. Dermatitis herpetiformis, basically it is on the this bony prominences on the knee joint, on the elbow joint. So dermatitis herpetiformis is one of the extraintestinal manifestation of celiac disease. That's what. So according to the options which I have made, that is option number D will be the best answer, A plus B. Did you understand? Very good. Next question. Infant came with vomiting, jaundice and hypoglycemia. Now which very importantly, which inborn errors of metabolism, very importantly, the patient will have jaundice and hypoglycemia. So we all know that whatever I feed my baby, doctor, whatever I feed my baby, the galactose usually gets converted into glucose by the help of GALT enzyme. In a case of galactosemia, this enzyme is absent, so the baby will land up into the glucose will not be formed, and the baby will land up into hypoglycemia. So where do you see hypoglycemia? Galactosemia, the patient very importantly will be a case of having hypoglycemia. Why it is not a Wilson disease? Wilson disease should have intention tremors, should have KF ring. Why it is not Menkes disease? Menkes, someone should have commented on the hair of the baby, kinky hair. So Menkes disease, like that you should know. Done. Next question. Yes, the next question was this graph. One of my juniors said okay, there were 3 lines. So one line was like this is line number A, one line was like this, line number B, and one line my junior said that the line went and it fell down like that was line number C. So the question was, in which line the baby growth is gone or going down or stunted like that. So in which graph? In general knowledge, I think see A and B are almost running parallel to the 50th percentile. This is written 50th percentile. So and this C wala graph is falling down. So this will be a graph which is significant impaired or retarded or impaired basically in the baby's graph like that. So C will be the best answer. Okay. Next, which is the most commonest type of congenital diaphragmatic hernia? This was the exam question, as in they have given a scenario, baby with distress, with scaphoid shaped abdomen, and bowel sounds in the chest. So you'll think of congenital diaphragmatic hernia. Which is the most commonest type of congenital diaphragmatic hernia? It is the posterolateral variety, which is also known as Bock-Dulac hernia. So B and C both are the best option. Yes, exactly, Kamal. Very good, Swati. Very good, Kamal. This part is done. That's it, finished. Last question was regarding a congenital defect which they had shown just on the picture like that. So this is a case of bladder exostrophy. Exactly, Swati. Very good, Swati. Very good, Kamal. Very good, Shiv. So that's what. So this is the one, bladder. You can see a exposed urinary bladder. So that's what. Why it is not omphalocele? So this is omphalocele. When the intestinal contents are out but they are covered in a sac, that is omphalocele. Why it is not a case of gastrochisis? This is gastrochisis. When the intestinal contents are just out, okay, and there is no covering. So this is gastrochisis, remember that. And why it is not Meckel's diverticulum? Because Meckel's diverticulum looks like this extra pouch over here, which is seen in 2% of babies, which is 2 times more common in males, and that's what. Done, finish. Yeah, so this part is done. Last question. Okay, we have a 2-year-old child who is stable, but ECG is showing PSVT. ECG is showing PSVT, this paroxysmal supraventricular tachycardia. For that, we all know the drug of choice is adenosine. Now the question is, how much should I give adenosine? What is the dose of adenosine? So adenosine, see, before till the exams, the question was what is the drug of choice of PSVT, paroxysmal supraventricular tachycardia? The answer was adenosine. This time now they are asking the dose of adenosine. Remember, give 0.1 mg per kg adenosine, give 0.1 mg per kg over 1 to 3 seconds at the first attempt. So you have to give 0.1 mg per kg. If there is no response, then you go for 0.2 mg per kg. Has to be given very quickly, like over 1 to 3 seconds. So 0.1 will be our best option. 0.1 mg per kg per day will be our best option. Yes, Swati, you are right. D is done. Okay, ILR image, and in lowest compartment question, which vaccine is kept? Okay, this is a ILR, ice-lined refrigerator, we all know that. And in the lowest compartment, what you kept? So lowest compartment, we all know it's seen over here, OPV. So in lowest compartment we gonna keep OPV. So OPV will be our best option. Okay, that you should know. Next one, a mother delivers a 2.5 kg baby with a normal vaginal delivery in a rural area. Which of the following is incorrect? Exclusively breastfeed the child, obviously that will be correct. Skin to skin contact, yeah, that's very correct. Clean the eyes, yes, we should clean the eyes normally. And bath the baby with warm water immediately, no, after few days we start bathing the baby, not like suddenly. So B will be our best answer. Done. Next question, which of the following is not a drug of choice of ADHD? Attention deficit hyperactive disorder. In general, methylphenidate is the drug of choice. The question is, which of the following is not a drug of choice of attention deficit hyperactive disorder? The drug of choice is methylphenidate. You know, na, ADHD patient attention deficit hyperactive disorder, they are inattentive, impulsive and a stereotypical pattern. Inattentive, impulsive and stereotypical pattern, where you give methylphenidate. So all the drugs you can give, like in general the list of drugs are there: methylphenidate, dexmethylphenidate, dextromethylphenidate. Then if not relief, then you can go for atomoxetine also, which is an antidepressant. But serotonin and norepinephrine reuptake inhibitors, SNRI, they are not the drug of choice for ADHD, remember that. That's it, done. And in one question they had asked regarding the cleft lip repair. So the timing for the cleft lip repair, if I talk about only cleft lip, if you are having a unilateral cleft lip, your operation will be done by 5 to 6 months. And if you have a bilateral cleft lip, as early as possible, 4 to 5 months I can do the operation. If you have both bilateral, 4 to 5 months I'll start the operation. If you have unilateral, 5 to 6 months, that you should know. That's it. That finishes this important points, important recall questions which came in Neet Pg 24. These are the recalls, plus minus will be there, they are just the recalls. And that's it. Thank you so much everyone. And before leaving, the quote is, there are two types of people. Which one is you? This is one who has done little bit of hard work and kind of stressed and depressed. There are the ones like me and like you who are just working hard and beautifully accomplishing things in life. So what do you think? Are you the spotter number A or are you the spotter number B? Think about it. Thank you so much everyone, and thank you so much for coming to this 5:30 AM series. God bless you. Your rank is done. Your rank is definitely sure, because you're working so hard. So thank you so much everyone. Please take care. See you tomorrow in the 5:30 AM on Instagram. Till then, take care and bye bye.